This is Mayor Ken Tedford. I'd like to call this meeting of the Central Nevada Health District to order, and if we'd all rise and pledge allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let's switch out, Shannon. Would you give him a different one?
Thank you. If you could take roll, please.
Okay, roll call. Chair Ken Tedford,
Here.
Vice Chair Cassie Hall,
And if I may, just for the record, Cassie Hall is not a member of the board at this time, and so she will not be called for roll.
Jim Barbie,
Present.
Shannon Ernst,
Present.
Justin Heath,
Present.
Bob Erickson,
Present.
Denise Ferguson,
Present.
Tyson McBride,
Present.
Larry Rackley,
Present.
Jeb Rowley,
Present.
and Rick McKay.
Okay, thank you. We'll go to item 4 on the agenda, public comment, which will be general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision could be made. Is there any public comment? Being none, we'll go to item 5, verification of the posting of the agenda.
Julianne Iconin, for the record, the agenda was posted on the 8th day of December 2023 between the hours of 8 and 9 a.m. at the locations listed on the agenda in accordance with statutes.
Okay, thank you. We'll go to item 6, consideration and possible action, approval of the agenda as submitted or revised.
Mr. Chair, I move to approve the agenda.
And Mr. Chair, if I may, I believe there's one revision to the agenda in that appointment H will be moved up to be heard after item 10A, I think would be the only revision that I'm aware of.
As amended.
I'll second the motion, Bob Erickson.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? The amended agenda has been approved. We'll go to item 7, consideration and possible action, approval of the minutes of the meeting held on October 26, 2023. Do I have a motion to approve those minutes?
For the record, Larry Rackley, I'll make a motion to approve.
We have a motion. Do we have a second?
Second.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? None opposed. The motion carries, and the minutes of October 26, 2023 have been approved. We'll go to item 8, the health officer report. Darren? Oh, the health officer, I'm sorry. Ted, Dr. McDonald.
Hello, Dr. McDonald for the record. Thank you very much for being here this afternoon. Appreciate the opportunity to be here and work with you. I presented my report that's there, and if there's any questions, I'll be glad to go through it. I've got maybe one or two little updates. The CDC released a health advisory notification today. It refers to a vaccination for RSV, COVID-19, and flu. Because of low numbers of vaccinations throughout the United States, there's a concern now that we're going into the season and some areas are having increases in RSV, flu, and COVID-19 is they are asking that the health districts and public health work a little bit harder to get folks vaccines. And I've sent this notice out to our members in our district here, so I passed that along to them. The second thing that I'll go over is sometime back we were concerned that there may not be RSV vaccines for pregnant mothers and for babies in Churchill County. The cause of this is the commercialization of a lot of vaccines, and in that process, RSV was not on many insurance plans. So they either have to be out of pocket, or in some cases, like Banner Hospital, when a woman comes in to deliver her baby, it's a package deal. They pay a set amount of money, whether they're there for a day or two, or what sort of services they receive. The cost of the vaccine for RSV would be almost $300. So Banner would see $300 less if they provided the vaccine. Most hospitals are in the same situation and don't provide it. We have a 72-hour window for babies that don't get the RSV vaccine to really provide them an effective dose. Brenna Goings, the manager at the Banner Clinic, has brought the RSV vaccine in and made available to the pediatricians there and to primary care. So the trick is making sure that when the babies, after they're born, they get into the clinic, they get their vaccine. The clinics also now have RSV vaccine for the mom. The reason we give it to the mom is mom makes antibodies to the virus, and it goes through the placenta, and the baby has some protection right at birth. So that's in place now, and also Walgreens has been nice enough. They have the vaccines in, and they're not afraid to provide it to babies or to pregnant mothers at 28 weeks. So the community has done a good job of responding to a plea for help. And do you have any questions regarding anything else?
I'd like to do a follow-up on this RSV. You list the COVID, numbers for the 4 counties. What does the RSV numbers look like in these 4 counties?
We just had the state health meeting, and right now the rurals are not seeing very much of the RSV. It's seen primarily in Las Vegas and in Reno. But we have, the reports that I receive are the COVID-19, and that's primarily it right now that we're receiving, and the tuberculosis. So those are the ones that I directly receive, and then the others are kind of what I'm getting from Washoe County and from Southern Nevada, and what's on the epidemiological website for the state. And at this point, we're not seeing drastic changes.
So in those RSV numbers in Washoe and Clark, what age groups is that RSV in?
Well, it actually hits most age groups. It's a pretty even thing, but the groups at risk are children and adults over the age of 65, and unvaccinated babies. And I didn't see any hospitalizations for Washoe County at this point. I have seen for flu coming up, hospitalizations for flu, and we still have hospitalizations for COVID-19. But our COVID-19 hospitalizations match up with what the United States is, and that's about 4 per 100,000 people.
If you're vaccinated for flu, does that help your RSV numbers stay down? Or is it if you're vaccinated for COVID, does that keep your RSV numbers down?
There's no cross activity. So if you get one vaccine, it doesn't help you with the other virus. So the vaccines are specific to the type of virus that's there.
So are you saying if you don't get vaccinated for the flu or you don't get vaccinated for COVID or either, it doesn't help you with RSV anyway?
If you get vaccinated for RSV, it would help you, but if you don't get vaccinated for the other two, there's no crossover.
So You have to get vaccinated for RSV and able to help you with RSV. If you
That
get
is correct.
vaccinated for the other two, it doesn't help you with RSV.
Correct.
I did them both. Same day, same arm. And it
Both
was-
what?
And it was sore.
Both what?
RSV and the new COVID.
I think there needs to be more education in that. I think there's a lot of confusion out there as to what helps what.
I agree.
And I think people think there's a lot more RSV that is out there than what there is. Not that, I don't know what education that would require, because you don't want people to, that's a false negative to tell people there isn't any, and then all of a sudden, there is a lot because they didn't do anything about it.
Mhm.
But I think there are people that think if you get vaccinated for one of those two I mentioned, that helps you with RSV.
Mr. Chair, and I just wanted to ask, because I think your new epidemiologist could actually pull those numbers from EpiTrex, and it shows those active and the trends, which might be a really good way to educate, to show how many have been here, and they can break it down by age groups and can do a comparison for all the communities. So that might be a way to start that, and then do a vaccine educational
Yeah, and
series.
I think that's a good point, because I think there's a misconception that RSV is only the 65 and older, not that the younger age babies you just talked about.
Yeah, the most susceptible and fragile age group is newborns.
Makes sense. It makes sense, but I don't think that's a common thought out there.
And there is some,
You're trying to reach young moms and young dads about that, instead of trying to reach the senior citizen.
and there is, we learned with COVID-19, a lot more people heard about something called cocooning, where people around a baby or around a fragile adult get the vaccine to help protect that individual, not so much that they're at risk of hospitalization or dying, but bringing that, making sure that everybody around that person that's fragile is vaccinated and less likely to give them the virus is also an important thing to know about RSV. The difficulty with the vaccine still comes down to right now in that transition from all the vaccines being paid for by the federal government in the epidemic, and now we're going to the commercialization, and some insurance companies aren't required to cover the vaccines until after the beginning of the new year, and the cost is prohibitive. The other thing that I'm seeing is it's a pervasive thought that COVID's just another cold now. RSV is just, it only affects old people and babies, so it's not a big deal. But this particular year, with the combination of people just think it's a cold and tired of getting vaccinated for everything and being told what to do.
Well, that's a separate issue of vaccines, but I think who is attacked by RSV is another issue. What age groups, whether or not someone wants to get a vaccine, that's a whole nother issue, and maybe 4 counties differ in how they feel about vaccines, but I still think the education part of who's susceptible to RSV and who isn't susceptible and what vaccine works for what, that education piece still needs to go out. Now, whether they choose to be vaccinated, that's a whole nother issue. And the cost, and that's a whole nother issue in itself. But the education piece of what will work for what and who is attacked by it. And, you get to grandmother and granddaddy and tell them that they're susceptible, but so is their daughter or son's child, that's going to be born. And they have some influence on that younger set. that helps too. But we have to separate these, and then we have to separate these things as we just heard from Shannon. I don't want to get caught up in national numbers of what someone in Manhattan thinks versus what someone in Laguna Beach thinks from what someone in these 4 counties think about, and what those numbers are in these 4 counties that may differ. So we always have to keep in mind is who are our constituents in this central region of these 4 counties. And what those numbers are that are affecting them. Not so much the nationwide numbers, I think. So I think it's good, Ted, to get the nationwide numbers, but I don't think to me, they're not as effective as, what's happening on Main Street in our 4 counties, so. Okay, thank you. I think that was good information. And you can take what I say with a grain of salt or not. It doesn't matter, so. Thank you.
Mayor Tedford.
Any questions for Dr. McDonald?
Chair, Dr. McDonald, this is Denise from Mineral County. The only thing I could add is that I'm happy to send over the NHA report that I get every week. I get a report that's specific to Northern Nevada, and it highlights what the specific numbers in and shows trending. So as of the 10th of December, it said there were 60 flu cases hospitalized and 49 were type A, and there were 24 cases of RSV. But it does show you what the trend is, and it tells you what it was last year. And if it's just from a number standpoint, that's another resource for you guys.
Yeah, I think Ted would like those numbers, Denise. I'd ship them over. I think that's good information that Darren and I'd send them over to Darren and Ted. Dr. McDonald would like
and then
those.
They can get in contact with the actuarial that reports those every week, and he can be on the listserv to get them. So I'm happy to forward it on.
Sounds good, thank you. Any other questions? If not, we'll go to the health officer. Any public questions? Being none, any health officer the health officer update. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman with administrative update. You have my report in front of you. My biggest update, I just want to make sure I recognize a couple new staff that we've hired. One is sitting in the audience with us today, Maria. Maria is our new environmental health manager. We are super excited to have her. Stole her from another jurisdiction. She has years of experience in environmental health and everything associated with that. So we're super excited to have her on board. Able to hit the ground running. The other one is Victoria. She's our new epidemiologist we have. Again, she is online maybe. I'm not sure. She's not here today, but again, wealth of experience in epidemiology, disease investigation. And so, to be honest, these 2 hires with Maria and Victoria are, I don't know what you'd call it, a coup, I guess, maybe, being able to get them on board and big for the district. And so we're excited to have that on board. Also, Veronica in our office, she was one of our medical assistants, has now moved up in a disease investigator role, has a lot of training ahead of her, but we're excited and hopefully she'll succeed in that with Victoria. So really have that disease investigation component with us now, so super excited with that. Outside of that, I'll answer any other questions you may have on that.
Well, I'll be glad to meet you. Anybody that he's super excited twice to have with us I'd sure like to meet you after the meeting, so. You must be pretty doggone good, so. Any questions for Darren or for Marie, who's sitting here? You need to come to a mic. There's one over here too that the county has provided
Good
for
afternoon.
isolated speakers.
Good afternoon.
These are COVID speakers that come to that one.
For the record, Maria Menjivar. I'm very excited to meet all of you. Excited for this new journey and to just be an active servant and help the rural communities in any way, shape, or form that I can. I bring with me over 15 years of experience in the environmental health and public health field, in the private and public sector, as well as the industry, since I've also owned my share of restaurants, ice cream parlor, and even a bridal shop. So I bring with me all of that experience and hoping to help the rural communities here. Thank you.
Well, those of you that are close to me here know that the ice cream shop intrigues me the most
Yes.
here.
My right arm is very strong
Yeah, good, good.
from
good.
scooping.
Yeah, love that ice cream. Thank you.
You're welcome. Thank you.
Welcome. I don't know that we want to talk to Veronica about disease. We'll save her for another day. Thank you, Darren, for having Marie and Veronica on board. Any other questions? Okay, being none, we'll go to 10A. Jeff, are you handling 10A?
I can. Jeff Weed, for the record, this is listed just as a letters received, no action or deliberation can take place on it. It's just there for your information.
Okay, what it is a resignation letter from Cassie Hall from her position on the Central Nevada Health District Board of Directors, which also, of course, she is the vice chair, which takes her as a resignation that, and I don't think that needs any action other than a notice from her. I then would like to, as the agenda allows, to take an item out of order, and I would like to move to item 11H, which is consideration and possible action concerning the election and appointment of a vice chair of the Central Nevada Health District to replace her as a vice chairperson. So does anybody have a suggestion for a vice chairperson to replace her?
And Mr. Chair, before we get into that, if I may just offer, the bylaws set out that the chair and the vice chair serve for a 2-year term. We're kind of here in between. And so the board, I don't know if the board wants to discuss if they want this appointment to just last the year and come up again for election when the chair does, so they're going, in and out at the same time, or how the board wants to handle that. But it's typically set that these happen in January. Again, we're here just on a vacancy, and so just something to consider as you guys talk about a placement and appointment for that position.
Yeah, that's up to the board. I just assumed they'd fill the position for her term, but it's up to the board what they want to do.
Mr. Chair, I would nominate, if he would not run screaming, he'll hopefully tell us on the phone, Dr. Justin Heath as vice chair.
We have from Jim Barbie, we have a nomination for Dr. Justin Heath as vice chair. Are you out there, Justin? Well, too bad. If that is agreeable to the board, I would accept that in that motion for Dr. Justin Heath to be the vice chairman. And do you want that, is that, in that motion, is that just to fill out the 2-year term, Jim?
Yes, sir, that was the intent.
Okay. We have a motion then to appoint Dr. Justin Heath to the vice chairman of the Central Nevada Health District to fill out the 2-year term. Do we have a second to that?
For the record, Larry Rackley, I'll second that motion.
We have a motion from Larry Rackley to second that motion. All in favor?
Aye.
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 None opposed? None opposed, then Dr. Justin Heath will be the Vice Chairman of the Central Nevada Health District to fill out the 2-year term. Okay, we'll go to item 11A, consideration and possible action ratification of a subaward between Public Health Preparedness Program, Bureau of Health Protection and Preparedness, and Central Nevada Health District in the amount of $155,335 to demonstrate achievement in public health emergency preparedness from July 1st, 2023 through June 30th, 2024. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is our grant from our public health preparedness partners at the state level. This particular grant will look at several different things, the largest portion of the grant being to hire a public health preparedness planner, really to help develop plans to administer the medical countermeasures, reduce our morbidity, mortality, ensure we have the ability to coordinate with our jurisdictional partners and our stakeholders to ensure adequate public health within the district. Yeah, pretty basic grant in that terms, just really a lot of planning effort with it.
Does anyone on the board or the public have a question for Mr. Winkleman? If not, I'd entertain a motion to approve this subaward.
Mr. Chairman, Jim Barbie for the record. I would move to approve the ratification of a subgrant or a subaward between Public Health Preparedness Program, Bureau of Health Protection and Preparedness, and Central Nevada Health District in the amount of $155,335 to demonstrate achievement in public health emergency preparedness from July 1st, 2023 through June 30th of 2024.
Do we have a second?
Mr. Chairman, Bob Erickson for the record. I second the motion.
We have a motion and a second. All in favor?
Aye.
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 Opposed? None opposed? So that subaward has been approved. We'll go to item 11B, consideration and possible action concerning ratification of reimbursement subaward between the Board of Regents, University of Nevada, Las Vegas, and Central Nevada Health District in the amount of $180,884 to reimburse for the Nevada Childhood Lead Poisoning Prevention Program from April 11, 2023 through December 30th, 2024. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is a grant that we received through kind of the State Nevada Division of Environmental Protection, through UNLV to us. This is a grant to help provide education to our providers, case management for children that present higher CDC blood level reference levels. It's a link to services for those children, ensure that we're able to respond to that if needed, both on the clinical side and on the environmental health side. This is, I want to make very clear, I think it was mentioned to me the other day, and a good way to put it is this is a case-driven grant, that we're not going to be seeking out, these lead level assessments or looking for kids. We want to make sure that we give the providers in the community that assessment tool, that if they see that, they know how they can refer over to our agency where we can either help on the clinical side and or on the environmental health side. We'll have that ability. This grant allows for our environmental health staff to become certified as lead assessment people. And so, again, just another avenue, another tool in our tool belt to help if needed.
Okay, thank you. Any questions from the public or from the board of Darren on this award? If not, I'll entertain a motion.
For the record, Shannon Ernst, I'll make the motion to ratify the reimbursement subaward between the Board of Regents, University of Nevada, Las Vegas, and Central Nevada Health District in the amount of $180,884 to reimburse for the Nevada this is a long one, Childhood Lead Poisoning Prevention Program from April 11th, 2023 through December 31st, 2024.
Do we have a second?
Second.
We have a motion and a second. All in favor? Aye.
Aye.
None- None opposed? Motion carries, and we'll go to 11C, consideration and possible action concerning a ratification of a contractor agreement between the National Association of County and City Health Officials and the Central Nevada Health District in the amount of $20,000 to enhance the programmatic emergency response activities from August 15th, 2023 through July 31st, 2024. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is a grant working with our National Association of City County Health Officials to help develop our emergency response plans so we can rapidly deploy during a public health crisis. Also to help us working with some of the templates and resources they have to develop some administrative emergency response plans too. So this is a smaller grant, but will go a long ways in helping us be a little bit better prepared in the event that we have another crisis.
Any questions of the board or the public for Darren on this agreement? Being none, I'll entertain a motion.
Mr. Chairman, I would move the ratification of the contractor agreement between the National Association of County and City Health Officials and the Central Nevada Health District in the amount of $20,000 to enhance the programmatic emergency response activities from August 15th, 2023 through July 31st, 2024.
Do we have a second?
This is Tyson McBride for the record. I second.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and we'll go to 11D. Consideration and possible action concerning approval of the job description for Public Health Preparedness Planner, assign it to pay grade 55, and authorize the hiring for the position. Jeff Stark, Churchill County Human Resource Director. Jeff?
Hi,
I'm sorry, Joff.
that's okay. We got it.
Joff Stark will do this for the Health District.
Good afternoon, Mr. Chair, members of the board. I am at the socially distanced table. This is Josh Stark, Human Resources Director for Churchill County. And I'm here this afternoon just to move forward to get this job description approved for a public health preparedness planner. This position has been approved already in the budget, but we did not have a job description for the position. So we wanted to draft that and get that set up and have the board approve it here. We're recommending that it be assigned to pay grade 55, which is the same pay grade as our environmental health specialist. Then once it's approved here, we'll take it to the Board of County Commissioners to get it put into the Churchill County compensation system so we can begin that recruitment. So Darren Winkleman's had a chance to take a look at this, and we think it meets the needs of what we're looking for. I always feel like with the job descriptions we're doing right now for the health district, those are always subject to change as we find out what we need, but we think this is what's going to cover us at this point. So I'll take any questions you may have.
Any questions of the board or the public for Joff? Being none, back to the council for discussion and/or a motion.
Mr. Chairman, I would move to approve the job description for the Public Health Preparedness Planner, assigning it pay grade 55, and authorize the hiring for the position.
We have a motion. Do we have a second?
For the record, Larry Rackley, I'll second that motion.
We have a motion and a second. All in favor?
Aye.
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 None opposed? Motion carries. Joff, thank you.
Thank you.
Appreciate it. We'll go to 11E, consideration and possible action concerning ratification of a sub-receipt of grant fund contract agreement between Central Nevada Health District and Churchill County Social Services in the amount of $281,080 for lab courier services in rural Nevada to Churchill County Public Health Lab and UNR Nevada Public Health Lab from July 1st, 2023 through June 30th, 2025. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman. I lost an arm wrestling contest with Shannon, so I now owe her $281,080. But this particular one is a contract between us and social services to help with the lab courier services to increase mostly our STI testing. This partnership will help us better serve our clients and ultimately help us reduce our lab services. I think this is to be honest, critical component in order how we move our lab testing to and from different facilities. And so I think this is a large piece of a puzzle that's going to go a long ways to help the district.
Okay, any questions of Darren and the public from the board or the public for Darren? If not, I'd entertain a motion.
Mr. Chairman, Jim Barbie for the record. I would move, looking for my spot here, to ratify the sub-recipient and grant funding contract agreement between Central Nevada Health District and Churchill County Social Services in the amount of $281,080 for lab courier services in rural Nevada to the Churchill County Public Health Lab and UNR Nevada Public Health Lab from July 1st, 2023 to June 30th of 2025.
Do we have a second?
Justin Heath.
Is that you, Dr. Heath?
Yes, sir, it is.
Okay, we have a second from Dr. Heath. All in favor?
Aye.
Aye.
None opposed? Motion carries. We'll go to item,
Mr. Chair, I would just like to note I'm abstaining since I am Churchill County Social Services.
okay, we have one abstention. So that isn't a 9-0 vote, that's an 801, I guess. We'll go to 11F. There's another health officer report, Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman, just wanted to give you a quick update regarding Dr. McDonald. He thinks he wants to take a vacation. I guess we'll let you go take a vacation. We just wanted to update the board while he is gone. We will have an interim health officer, most likely Kathy Patterson within our office, just to help with continuity in case something occurs within the district. We have that continuity, and we can give Dr. McDonald a little break for a while. So just an informational update that for the 2 weeks that he'll be gone. I think in December, we'll have an interim health officer for a bit.
And Ted McDonald for the record. Looking at what is the best practice in health districts, Nevada and other states, this is the way of making sure that there's continuity of care and that the chances of the deputy health officer being utilized are rare, but it's a possibility. So I appreciate your,
Does this need to be an appointment? You know, Dr. McDonald was appointed by the board. Does the interim health officer need to be appointed? This is only on here as informational only.
my understanding is it is a deputizing process done by the health officer. So the state health officer deputizes one of the people in, like, for the state. And the,
Well,
I know
we're
Washoe
not-
County and Las Vegas also do the same thing when there's a vacation.
The state is. I need Jeff to tell us what's supposed to be done here.
I guess it depends on what the board wants to do. I mean, the health officer is a contracted position with the board, and so it's Dr. McDonald's obligations or obligation to fulfill those obligations and the contractual obligations. And so, were he to set that up and have someone essentially working in his stead, at his behalf as his agent, I think that would be appropriate. If the board wants to agendize this and come back and do an official appointment of some kind, that can definitely be done. And so this is listed as a non-action item. And so it just depends on how the board wants to proceed with that. I think either way is appropriate. It's just what the board wants to do.
So did we appoint Ted, or or Dr. McDonald, I'm sorry, Ted, call you Ted, but did we appoint Dr. McDonald, or did we just sign a contract with him? Enter into a-
Yeah, he is appointed in that position, and then through contract, that's accomplished, and so,
Okay, so let's talk through this.
Yeah.
This is new to me, okay? So, in that contract, did we then say you can deputize anybody you want when you're gone?
I'd have to review the contract again. I have not reviewed that with this specific question in mind.
Doesn't matter to me
Yeah.
what the state does, because we're now operating on our own, and
Yeah.
this board is responsible for health care for the citizens in their respective counties, not the state.
Yes.
We may be signing all these sub-awards, whatever, with the state, but that doesn't make us any less responsible to the citizens that we represent.
Mr.
So-
Chairman, I had a question. What again is your time of absence?
Like tomorrow, probably.
No, it's from the 17th until the 27th
Oh, of December, okay.
of December.
So, yeah.
I have no problem with Kathleen Patterson, that's not the issue. She's fine. It's like our responsibility here. Can we just say it's okay for Dr. McDonald to deputize her? In his contract, can he just I would like you to tell me that's okay.
Yeah.
And then I'm okay because Dr. McDonald's still in charge of Kathleen Patterson for the time he's gone. He's still got, no matter where he is, he's 24/7, the health officer, and he's got eyes on what's going on here. Other than that, if we're representing people in these 4 counties, we're saying we're without a health officer from this board.
Yeah.
Yeah.
I think the way to look at it is that, as the health officer appointed by this board, my understanding is he'll still be available at times. It's not a blackout period. And so there needs to be kind of a liaison or someone who's acting as his agent to relay messages, to do things of that nature. And so it hadn't been brought to me that this would be an appointment of some kind, just that he would have someone who sits there in his stead that he can communicate with and can make decisions for him during that period. And I think that's appropriate, the way that is set up. Again, if the board wants to come back and officially appoint someone, that can also be done. But I think the way that this set up would be appropriate, and I think it would be legally okay.
It's not me, it's the board's pleasure. I mean, I'm just one person's, but
Mr. Chairman, I think you bring a valid point. The only struggle that we've got is I don't think we have any authority to do anything about it, and I think it leads us in a conundrum. I would be happy to bring this forward. I think we're going to have to rely on basically it being a liaison, as it were, to Ted while he's absent during this short amount of time. And then when we get down further in the agenda for requested agenda items, I would put forward at that point a request that we come up with a procedure that probably should look at actual appointment of a deputy health officer
that, yeah.
and ongoing service, as we each had in our health boards prior to this merger. I think this is one of those examples of learning curve. We don't know what we don't know until it's right in front of us.
yeah, I agree that we need a deputy health director, and perhaps under, as I sit here, under Darren's, he's the administrator, perhaps under his purview, he has the ability to, in emergency situation, appoint a deputy health director. Maybe you do that, Darren. Make a memo that you're appointing a deputy health director in an emergency situation, because we're in a conundrum here, as the word that Jim uses, and I think it's a good one. And you're appointing a deputy health director for this time frame, and then we'll do it with this in future agenda items.
For the record, Darren Winkland, that would be helpful just in terms, this one was a little bit, I guess, better timing just because we knew a board meeting was coming up. But certainly if we were in between board meetings having to do this, then that becomes potentially an emergency board meeting, and so.
Well, I would back
you
up. I'm just gonna be totally honest. The minute you knew this, if you'd have made me aware of this, I would have had it on the agenda to make a deputy for him, because I know he's appointed. And you saw how quickly I wanted to make a vice chairman, you know, without a breath, not several agenda items later. Those things are very important to me. Who's in charge when and what happens. So, yeah, I would never put it on for advice only, something this important. So, let's get through this to the next agenda item, and well, thank you for the advice on F. She's fine. I don't think I'm disparaging Kathleen Patterson at all. She's fine. Let's move on. No, there's no more comment to 11G. Consideration of possible action, discussion and approval of the process for selecting and appointing members to the Food Protection Hearing and Advisory Board. I don't know if you've all had a chance to look at this, but I think this is Darren's purview. I mean, he's the district administrator. He should be reviewing the apps and bringing back the recommendations at the next board. I don't think we want to interview 8 candidates. I don't think we want to look at all the apps. I think that's what we hired him to do. So without listening to whatever comments you may have on the 3 suggestions, I just think the 3rd suggestion is a suggestion we hired Darren to do. Any comments from any board members?
Jim Barbie, for the record, I would concur.
Actually, for the record, I concur.
I guess we're in a learning process. That's
Bob
just-
Erickson, I concur also.
Shannon Ernst concur.
So. Yeah, why don't we? It says possible action, Jim.
Mr. Chairman, I would move that we direct the health administrator to review candidates, advertise, and bring back recommendations for appointments to the regulations governing food establishments. Let me get that right. I'm sorry. To the Food Protection Hearing and Advisory Board, that would, enough candidates that would fill that full board up.
I think you got your 8 apps, don't you? You said something about already having 8 apps. I think he's halfway through the process. Yeah. Okay. Do we have a second?
Bob Erickson, for the record, I'd second the motion.
All in favor?
Aye.
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 None opposed? Motion carries, and we'll go to item 12, consideration of future agenda items.
As promised, Mr. Chair, Jim Barbie, for the record, I would request that we look at an agenda item that gives us a procedure or process for the appointment of a deputy health officer to serve at times when the health officer is otherwise disposed and cannot be contacted or is on vacations, which is totally appropriate. And then I would also request another agenda item in the future agenda. We're basically 6 months into the creation of the health district, and I think it's important. We had a lot of money items coming in. It looks like the majority was revenue coming in, and that's fantastic. But we've also had quite a few expenditures. To get kind of an update on the financials and what our current standing is, I know that we created a budget with the best intentions that we possibly could, but we want to ensure that if we are going to have some shortfalls with this is no suggestion that we are, but if we are, then that comes back on the membership of this health board, and us, for one, are working through our budget process, and I know the other counties are on the same schedule, so that we can kind of, at 6 months, take another look and take a better forecast of where we are. We may have to do some budget modifications, some things like that. I have no idea. But I would request a financial update at the next meeting.
Okay, anything else? All right. Consider and schedule future meetings. We'll have one in January. Second Thursday, we'll go back to 1:30. I thank you for moving this to 2:30 today. I wish a Merry Christmas to everyone and a Happy New Year, because we won't be back for then. Enjoy yourselves and be safe. We'll go to item 14, public comment. Is there any public comment, general nature, not relative to anything on the agenda today?
I'm going to be your thorn, Mr. Chairman.
Okay.
Jim Barbie for the record. One more opportunity under the public comment. Two things. We had a presentation made to the county earlier this week that is I don't even know how to describe it because I'm not learned enough, but it's an online software app, whatever you would call it, that you subscribe to, and it has unbelievable data capacity on our community and our community compared to neighboring communities and our communities as a block, and some of the other counties may already be familiar with this because I think they have some contracts with some of the surrounding counties. But an example is we looked at over the past 4 years, 5 years, the Life Center. And basically, a fellow was able to create a poly shape around the Life Center, and based on cell phone data, be able to identify, on average, the number of people that are coming into the Life Center daily. And be able to do that in blocks of months and weeks, and then be able to say, out of those people, here is where their residents are centered and where they're coming from. Did the same thing for Sand Mountain, which I might add, BLM says there's 9,000 people during Halloween. The small campground alone had 25,000 people in it this last year, by the way, per their data. Wow. So powerful tool. Has a specific section that was on COVID, but I would assume, and because people have some of the COVID data stuff on their apps, right, on their phones, but generally speaking, as we get this thing going, we would be able to see the average number of folks, if they spend at least 7 minutes, is how they have it set up, that go to any of the clinics that we would have in our neighboring communities as part of the health district, as well as the clinic that we have here. And it just absolutely blew my mind what they could extrapolate. Another example, they could look at all the fuel stations and the amount of folks that were pulling in and fueling. Obviously, they couldn't tell you how much fuel they were buying or the volume of their fuel tank, but we can take, from what I understand, the actual sales tax, fuel sales tax, and lay those timelines over the top of those usage timelines and have the ability to kind of predict moving forward based on volume of usage in those fuel stations what our fuel tax is going to look like. Where it's been quarterly, we can do that up to the past 4 days. And so in most cases, real time. I think we are going to look at it at Churchill County. I think there might be an opportunity for the health district to look at that tool and be a part of that data opportunity, but just really fascinating. And so as we learn more, I would bring that back to the health district if you guys find that interesting, or you folks. And then lastly, I am effective the 20th with approval of the county commission next week, will be resigning from the health board with a recommendation of Pete Olson to come in and be appointed by the commission to the health board. As we had originally mentioned in the work that we've done since COVID to try to help and assist in getting the health district up, it was both Shannon and I's intent to and eventually move out and try to get public representation on the board representing the local community. And I think that Pete is an ideal person for that, representing 12 years of service as a county commissioner here in Churchill County. And then I think in the next couple of months, you'll probably see Shannon following my stead. But I just really appreciate being a part of the board and having the opportunity to serve. And you'll see lots of me. I'll be around and assisting at any time anyone needs any help from me. But I think I got to focus on my real job. But appreciate it. Thank you. That might have been more than 3 minutes.
Well, Ms. Shen, we'll waive the 3 minutes for you too. Thank you for your work on behalf of the health district. Any other public comment? Okay, nothing else. We stand adjourned. Thank you.